Hello, everyone. It's my pleasure to be with you today for the opportunity to discuss inclusive language in CF care. Our workshop objective is to highlight how language can significantly influence both patient care and clinical outcomes. And the approach that we're taking to do that is to provide you a definition of inclusion and inclusive language, give you 7 tips for using inclusive language, and then give Jaelyn Cooper an opportunity to share with you 2 personal stories that really amplify ways in which language has shaped her CF journey. I'm going to start by giving you the definitions of inclusion and understanding that this definition has 2 parts in it. The whole idea of actions that we can take and feelings that result from the actions that we take. And noting the emphasis on offers respect in words and in actions for all people, because that comes up very significantly in the context of the definition of inclusive language from the Linguistic Society of America. Those 4 components of the definition and highlighting conveys respect to all people as, in my opinion, one of the most important aspects of what inclusive language accomplishes. And knowing that we often unintentionally use language in ways that can create disrespect for people, knowing and understanding that this is an opportunity for us to use language in an intentional way to not have that happen. And knowing that just giving you the definition isn't sufficient for helping us understand how to actually use inclusive language, I'm going to give you 7 tips that can help you use it effectively. And these are the 7 tips that I will be covering, starting with the whole concept of being willing to ask people and not to make assumptions. If we don't know what is appropriate, to have the ability to ask. But a caution that I provide first is that when you receive your answer, to make sure that you don't seek to invalidate it, to question it, or to make fun of it. This is feedback that I've received from many people when I've been providing these workshops. And knowing and understanding, giving you an example here that's from my own lived experience, where a person did ask me how I self-identify, but then they gave me what I would consider an inappropriate response to how I self-identify. So definitely want to encourage you to always be respectful in how you receive the information from a person. And when you're interacting with people for the first time, to ask them how they would like to be referred to. And understanding that you really want to be intentional about referring to people in the way in which they want to be referred to. And a progressive style guide is a free resource that's available online that I think does a really good job of looking at inclusive language in many different contexts that people find very useful. One of the questions I'm asked often is, how do I ask the questions, especially when I'm filling out forms or setting up forms for people to fill out. So there's another opportunity here to look at the difference between using exclusive language and inclusive language as your options for when you're asking for demographic information. And another example, and this is from How to Use Inclusive Language in Healthcare, which I think is very appropriate in the context of looking at the implications for the CF community. Another principle, number 2, is to avoid ableist language. And so I provide you with a definition of ableism first. And with an understanding of that definition, the ability to understand how ableism is communicated through language. And using some examples here. And another set of examples where we're using ableist language in contexts that really don't need it. Um, and another good resource if you want to explore more fully concepts around not using ableist language. It's the Disability Language Style Guide, another free resource that's available from the National Center on Disability in Journalism. And I like the way that this particular resource is set out because it gives you the word or phrase to avoid. Then it gives you background information on why you should avoid it. And then it gives you terms or other phrases to use instead. Because I think that often people want to know and understand the why behind why they shouldn't use particular language. And it also helps, I think, make it easier for you to actually adopt different language. And there's additional concept here in this area is to think about avoiding using absolute language. Because when we use definitions, I mean, we use words such as absolutely or never or every single time, we're implying that that's the experience of the majority and that it applies to everyone. But it's very seldom the case in the context of our interactions with people when we're talking about relationships. Principle number 3, avoiding idioms and metaphors. So I always like to start with the definition of idioms and metaphors so we all understand of what we're speaking about. And 2 types of idioms and metaphors in 2 different contexts. Ones that may be demeaning to groups or cultural traditions, and ones that are militaristic and maybe considered punitive metaphors. Quite a bit of feedback from people in the workplace that they're made to feel uncomfortable when people are using these. And also in the context of using idioms and metaphors, many people, if you're looking at situations where you have people from many different cultures, they find that it's hard for everyone to understand what you're trying to communicate when you're using idioms and metaphors. So here's just an example of idioms and metaphors that people are encouraged to avoid when they want to use inclusive language. And just one example of things that may be idioms and metaphors that may be demeaning to people is to think about not using blacklist as always being a negative, with the focus here on black being negative and white being positive, to use instead something that's more specific with regard to what you're referring to. So there's a higher level of specificity when you call something denied list or unapproved list versus blacklist. And just an example of some punitive or militaristic language and punitive metaphors, avoiding things that rely on our understanding of something that's militaristic. The next principle is using humanizing language. And the most prominent aspect of humanizing language is using first person people first language, which always gives the sense of humanism to a person by identifying them first as a human being. There's also identity first language, where the disability is mentioned first. But in situations, it is really based on the preferences of the people that have the disability or are living with the disability and what their preference is. So again, we go back to the whole concept of asking to determine what's appropriate. And a lot of information out there, again, thinking about the healthcare community. Person-centered language is critical to recovery and your efforts to provide an open and welcoming environment for everyone. And what comes in also in the context of using humanizing language is not wanting to label people with the language that you're using. So we have the opportunity of referring to someone as a person with a substance use disorder rather than referring to them as an addict. So you're avoiding the whole concept of labeling them with a particular situation. Parallel construction also comes into play when we're looking at using humanizing language and avoiding situations where we are showing a level of respect and recognition to one person and not doing the same with the other person or people that are being referenced in the same space. And also in the context of parallel construction, encourage people to not use the term minority or minorities in referring to groups of people, because it does not have it doesn't allow people a sense of humanism. It implies a lower status also in the context of how we use it. And all of these relate to the opportunity that we also have to use asset-based language rather than deficit-based, and really giving a higher sense of agency to people in the context within which we're referring to them. The fifth principle to share is the opportunity we have to pronounce and spell names correctly. When I'm working with people, I often have people give me feedback that they believe that people don't pronounce, that they're harmed by this idea when people don't pronounce their names correctly. So you do have an opportunity. There's another free resource out there called pronouncenames.com, where you can go in and type in the spelling of the name, and chances are very good that you'll be able to listen to the name being pronounced correctly so that you have the opportunity to practice how the name should be pronounced. And there's also, if you want to create a audio piece for anyone to be able to listen to so that they can hear how you want to have your name pronounced, you can go to Name Drop and create your own audio and be able to put that audio on any type of communications that you're using so that someone can go in and always be able to hear how your name should be pronounced. So I've done that for myself and included on my communications when I'm sending out my emails to people. And it's a free service. Number 6 is to standardize respect for and sharing of personal pronouns, just to incorporate sharing and personal pronouns into all of the work that you do in terms of introducing yourself in multiple ways. And I am 65 and was definitely in the tradition of not using they as a singular gender neutral pronoun. But in today's language, here from the Linguistic Society of America, it is appropriate to use they as a gender neutral pronoun. So it's important to acknowledge and understand that that is appropriate in today's interpretation of our English language, and looking at a great resource that's available that talks about ways in which we can be intentional about offering our pronouns in the workplace. So we just include that in the ways in which we introduce ourselves. And I went through, and you can see here in that I have pronouns on all of my name tags, and I had my company name tag redone to have my personal pronouns shared on it. And when I get a handwritten opportunity to do a name tag, I will also add my personal pronouns to it. Because again, I'm just standardizing sharing of my personal pronouns as a way in which I'm always introducing myself. And principle number 7 is the opportunity that we have to use gender neutral language. And just as a reminder of what the definition of gender neutral is, always sharing that first. And really want to emphasize the research around we can assume that using he or masculine terminology is considered gender neutral. And the research showing us that although it may be intended as gender neutral, in actuality, it's not gender neutral. And that we need to use other terminology to make sure that we are indeed being gender neutral. And one way in which we are commonly using gendered language is when we're doing greetings with others. And you can see up there, ladies and gentlemen, ma'am, sir, girls, guys, etc. Those are all considered gendered terms. So it's intentional to be able to use gender neutral terms and be able to use friends or folks or everyone, all. I'm in Tulsa, Oklahoma, so it's perfectly fine with me to use y'all as a gender neutral greeting and being able to communicate with people. And I do share this snippet piece from a publication on why sexist language matters, because it demonstrates that using guys as a gender neutral default term is not actually interpreted as being gender neutral. And here a 5-year-old hearing her teacher referring to guys as the terminology and feeling that she was not included in that. So just as an example that resonated with me quite deeply when I read it. If you do want to change the terms that you're using for your greetings, this is a great way to do it. It is to put the greetings that you do want to use in a place where you're going to see them regularly for at least 2 weeks, and to use this visual way to reinforce, to change what you're going to say. So this is actually an example from my own smartphone where I went in and made my wallpaper terms that I wanted to use in lieu of gendered terms. And so I did make that change to getting comfortable with saying everyone and y'all when I am greeting people. And if you don't want to use a smartphone, you can use sticky notes, or rather virtual or real sticky notes. The whole point is to put it in a location where you're going to see it constantly throughout your day and be able to do that for several weeks so that you're reprogramming your brain to say something differently. So that was a quick overview of the definition of inclusive language and 7 ways in which, or tips that we can use to incorporate inclusive language into our vocabulary. And now I'm going to turn it over to Jaelyn so she can share with you 2 examples that she has of ways in which she's encountered language that was not inclusive, but in turn giving you examples of ways in which you could respond in an inclusive manner. All right, I'm going to stop sharing and turn it over to Jaelyn. Thank you.
Thank you, Linda. Hello, everyone. My name is Jaelyn Cooper. I'm from Little Rock, Arkansas, and I've been living with cystic fibrosis since I was 18 months old. First, I want to say thank you for allowing me the opportunity to speak and for listening to my story today. I hope that what I share can be able to help someone, whether it's either to relate, uplift, encourage, or even just to remind them that they're not alone. So, for my first story today, I want to share, of course, about the importance of inclusive language. This particular time goes back to when I was a teenager. At the time, I had a severe exacerbation for CF, which I ended up in the hospital for several months. At that time, I was very scared. And during that time, what really stuck out to me was was more than beyond the physical symptoms that I was experiencing, but it was about the treatment that I was receiving, not just medically, but through language. So to explain that, one of the providers that was assigned to my case made me feel as if I was feeling blamed rather than supported. They were asking me things such as, "Were you doing your treatments?" And also stating things to me saying that I needed to be more compliant. And at that time, I felt like as if I was doing the best that I could at that age, especially with juggling school, um, fatigue, and also just the pressure that comes with trying to appear normal in a sense, and also navigating the challenges of becoming a young adult at that time. With that experience, I walked away feeling as if my illness was my fault, and I felt like that my effort wasn't good enough for what I was doing to take care of myself. And those words really stuck with me for a long time, and it made me feel badly for a while. And as someone with CF, I was already struggling with feelings of being a burden or just questioning or blaming myself for what I was going through. And at that time, that language made me feel worse. So, one way how I feel like the conversation could have gone differently with that provider, if they would have just taken the time to understand where I was coming from mentally and also emotionally. And it could have been an experience that was more positive and it could have turned into an empowering experience instead. So, with that, I imagine something just some support on maybe them saying, I understand that it's tough to stay on top of your medications and treatments, especially with at your age and also with life being so busy. And let's talk about a way how we can work together to make things easier for you. I feel like if I would have had that sort of support, it would have made all the world of a difference. Also, within healthcare, one thing that I realized about inclusive language were the words that they were speaking, such as the words compliant, which implies obedience, whereas adherent involves collaboration. So, therefore, it would have entailed more so working together and acknowledging that I have a voice and that I have valid barriers and that I have a unique experience and a unique perspective. So, therefore, if I would have received that, then I could have been recognized as the patient who is going through these things and who knows about themselves. It's also important to be mindful that when using inclusive language, it should be rather inviting rather than instructive, which can make a very big difference in how it's received. It turns blame into understanding and it turns shame into partnership. And at that time, what I needed then wasn't judgment or what I felt was judgment. I needed someone in my corner and someone just to say, let's figure this out and let's figure out how to process your emotions and also how to manage everything while being able to take care of yourself at the best of your ability. So, inclusive language, it opens the door to empathy and it builds trust and it makes healthcare a lot safer in that it fosters taking a holistic approach and treating, excuse me, not just medically but emotionally. So with that, we want to talk about inclusive language, and it's important to be mindful and approach every interaction with understanding and words that matter, and also assuring that the patient is left feeling dignified, and also being able to assure that the patient is being seen beyond behind being seen beyond the patient and being seen as the person. And that was my first example. And for my second example, I want to share of a time where I had my mother with me, and there was another time where I was going through another exacerbation, and we were speaking with our provider at the time, and we wanted to explain what I was feeling, and what had worked for me in the past and what we were concerned about. We weren't trying to take over or to take the place of the doctor. However, we were just trying to contribute to what they were offering us and for the treatment. Instead of listening, we felt that the doctor had shut us down with a very hard statement. And I remember this person saying that I am the expert here and I am the doctor. And with that tone, it was very authoritative, and it was very dismissive. And we also felt that it was combative. So with that, it created a wall that didn't have to be there, where there instead there should have been a bridge. And in that moment, we felt ignored, invalidated, and also powerless. And despite the fact of having to fight to hear my lived experience heard and my mom's deep understanding of my history with my health, it could have been offered as more context instead of an argument in a way. And so with that interaction, it left us with a very lasting impact, and it really broke our trust, and it made us very hesitant to speak up. Well, it made me hesitant, not so much my mom. However, it made me hesitant to speak up for myself, which can also be a struggle when you're sick. So with that, what I feel like that inclusive language that could have taken place at that moment would have been the provider just also meeting us where we were at, and also with providing the patient-centered care. Um, I believe that the medical expertise brought to the table, and to be able to state that you know your body and that your mom clearly knows your history. So let's figure this out together. And also just a thank you for sharing and just being able to let us know how we can collaborate together in order to devise the best treatment plan for you. With that, I feel like that, of course, again, would have made all the difference. And it would have definitely provided a shift from authority into a partnership with us as the patient and between the provider. So that lasting impact I felt would have definitely honored my voice and validated my mom's advocacy for me, instead of a way of interference. And it also would have transformed a very intense and disempowering moment into a moment of collaboration and also shared respect. So therefore, inclusive language is, of course, isn't just about being polite, but it's also acknowledging the patient's humanity and their expertise and just their simple right to be heard. And with that, it would have turned a moment of a power struggle into partnership, where healing would have been able to take place in the best form that it could have been. And I want to end that with thank you for listening to my stories, and I hope that I will be of help to someone.
Thank you, Jaelyn. You really did provide us with a true understanding of the impact of language in CF care. We can't thank you enough for being willing to share your lived experience with us today.
Yes, and thank you for allowing me the opportunity to share.